Hello and welcome to Wellness Wednesdays. I'm Dr. Stephen Ramos, Associate Medical Director with HealthTexas Primary Care Doctors. And every week we're going to bring you a video with special guests discussing important health topics. All right, well, welcome back. And today I have a special guest, Dr. Mae Sepulveda, one of our newer doctors over at our Wurzbach Clinic. Mae, thank you for joining me.
Thank you for having me.
And if you can, just for the listeners out there, just give us a little bit of information about yourself and how you ended up practicing here with HealthTexas.
Oh, okay. So I'm from the Philippines. So I did my medical school back in the Philippines. And then I did my residency training in family medicine in Pittsburgh. And then after that, I practiced a little bit in Massachusetts. And then for the past 6 years, I've been here in San Antonio. And then just recently, I joined HealthTexas. So I'm here.
Well, great. Well, we're very happy to have you. You're a fantastic doctor from, what we've seen and what you've told us and your resume. And currently right now in our medical center location on Wurzbach, correct?
Yes,
and
I'm there.
Are accepting new patients?
Yes, definitely accepting
Fantastic.
New patients
So,
over there.
If you're out there looking for a new primary care doctor, give us a call at HealthTexas Primary Care Doctors and get an appointment with Dr. Sepulveda.
Yes.
Now, today we're going to talk about diabetes, and I think this is kind of a very broad topic, but a topic that's pretty important in San Antonio. So, as far as, San Antonio, what portion of your population that you've been seeing here in town have diabetes?
It's quite a lot, I would say, right? I practice a little bit down in south side a little bit. I think where you guys are, it's really definitely a big population. Since it just started in Wurzbach location, it's still around the same though. You definitely see a lot of diabetics, even young patients, old patients. So it
seems like it's becoming just more and more prevalent. It's happening in younger and younger folks compared to, when we're taught in med school of looking at 40s and 50s and so forth, and this progressing kind of a disease, but we're seeing it a lot in 20 and 30-year-olds and even our pediatric patients as well.
Yes, absolutely. Yes.
And so, one thing about San Antonio is, statistically, we're one of the most,
high prevalence.
Unfortunately, unhealthy kind of high prevalence. And one of the things that's really driving that is diabetes and all the complications that happen from diabetes. So if we have people out there and they're worried and maybe they haven't been to a doctor in a while, what are some early signs of diabetes that people can look out for?
Okay. I mean, the classic signs, we call it, if your sugars are really, really uncontrolled and didn't know prior, would be you'd have weight loss, you'd lose, and then you'd be very thirsty. You're very hungry even though you're actually losing weight. And you're peeing a lot. So that's why a lot of patients, when they have those symptoms, they come to us. But those are really more classic, and those are really uncontrolled diabetes for a long time already that we sometimes see. But we say we do now a lot of screening tests, however, right? Even for just our healthy patients that come in our offices, because they have risk factors even before they have the classic symptoms. So before then, so some of our patients already know that they're diabetic or borderline diabetes even before they become what we call overtly diabetic.
Yeah. So really knowing family history, I think, is a strong thing to look out for. If mom and dad and grandparents and uncles and even maybe a sibling all have diabetes, well, maybe it's time to go visit the doctor and make sure start screening and checking for that type of a thing.
Yes.
So outside of genetics, what are some other things that can predispose individuals to becoming diabetic?
So race is another thing, right? So they say African Americans have higher risk, Latinos also have high risk, and even Asian Americans. I'm an Asian, I'm from Philippines, and then also Pacific Islanders. So we have certain populations that are higher risk for developing diabetes as well.
And so when should somebody go out and get checked or screened for diabetes?
Oh, okay. So usually, since, as I said, we usually just see our patients in the clinic. So you fall under these categories, your family history, your race as well, and then your weight. So patients are overweight or obese. We consider them high-risk categories for developing diabetes, or patients with even like the women who have like PCOS, polycystic ovarian syndrome, or there are other diseases like heart disease, then we have to screen them also for diabetes.
Yes. So a lot of things, and which comes first is diabetes and blood sugar metabolism disruptions lead to high blood pressure and heart disease, or back and forth. Really, we kind of see a mix. Usually they kind of go hand in hand. So one of the big ones is anytime I have a new patient, maybe someone who's never seen a doctor or maybe changing from another doctor, if their BMI or their weight is not ideal and a little bit higher than we expect, a BMI of over 30, with any kind of family history whatsoever, I think, it's appropriate to check some blood sugars to make sure that, we always want to find things early before they become a problem. We don't want someone to have symptoms of severe diabetes for years and years and years before we get there and we start treating them. We want to start it kind of early. So say if you're someone out there listening right now is strong family history and maybe weight's gone up over the last couple of years during the pandemic and whatnot, what are some things that individuals can do to better their chances of not developing diabetes?
Dietary changes, absolutely, and lifestyle, meaning exercise. So they do recommend exercising about, they say, 150 minutes a week, which is really, 30 minutes of exercise 5 days a week, right? So they say you can mix it up with cardio exercises and strengthening exercises. And then what else? The other thing during doing our readings is also getting up every 30 minutes. We can't be sedentary. Because that predisposes us as well to diabetes. So diet, of course, very big factor as well. So eating healthier, less processed foods, yes, and then more vegetables, less of our sweets, especially with the holidays coming up. So it's going to be a little bit harder.
It's always a bad time to go visit the doctor between November and January.
That's true.
Everybody kind of falters a little bit. And then, one thing I've seen, again, specific to San Antonio, when I talk to, a lot of my patients that are diabetic or pre-diabetic, what things should I be eating? What things should I not be eating? And my spiel, at least, is always, we want to eliminate those carbohydrates, those complex carbohydrates. And so what I start describing is breads, tortillas, rice, beans, potatoes, and basically describing Mexican food flat out.
And bread.
Exactly. And so what are some other maybe healthier alternatives, or what's some tips that you can give those listening of, when they look down at their plate, maybe I should be eating this and not that, or order something different?
So more vegetables for most of us, right? So, but less of the starchy vegetables that you mentioned. And, our plate should be, half of it should be vegetables and just a little bit of your carbs. You can still eat the carbs, with more complex carbs, but only 1/4, and then 1/4 of it would be like your proteins, right? So that would be usually what I would, describe to patients. It's hard when you just say, don't eat this, and this, but at least when you describe, in the plate, how much, what should be in the plate. And then our portion control is the other thing, right? We're, not a big plate, but smaller plates as well.
And what kind of tips do you give your patients about portion control? Any little things that you describe to them of when you should stop eating, or how much is enough?
Good question. I just describe more like, how big a plate would be and how big a portion size. Sometimes we use our hands to describe, how big a protein serving, one serving would be. But I just go through the basics, not really So if you have any other tips.
One thing that I do is what I think we do as a society, on the run constantly. That's true. Just eat really fast. And our body has a good way of telling us when we're full, but it's on about a 20, 30-minute delay, sometimes even more. So by the time people feel full and really satisfied, you're probably already overeaten a decent amount. And so what I tell people is just slow down. Just take some time to eat. Give yourself a good hour to take a meal in. If we're just eating in 15 minutes and on the go, chances are we're going to eat too much. And so what I tell people is, take a couple bites, sit back, and kind of ask yourself, am I still hungry? Yeah, I'm still hungry. Okay, have another couple bites. And whenever you can get to the point where you say, I'm not hungry anymore. I could definitely eat a lot more, but I'm not hungry anymore. That's when I trigger them to say, okay, that's the time when you need to stop. And you may look down at the plate and realize, well, I didn't really eat that much, but you know what? I'm not hungry anymore, so we're going to stop it right there. It's a good way for portions, because unfortunately, you go to a restaurant, you go somewhere else, the amount of food that we get is just tremendous. And it's really probably more than anybody should need to be eating. Yes. So portion control, like I said, is really important. Staying away from bland-looking foods and more colorful things like colorful vegetables and so forth is what you want to do. So as far as, we have a lot of diabetic patients that we see on a day-to-day basis. What are some things that, we really want to make sure that every time those diabetic patients come in and see us or go see a doctor, that we make sure that we kind of check and examine and go over every time they come in?
Yeah. I think first of all would be their sugars. So when they come in, we ask them about their sugars. Have there been episodes that it's very high or very low? Because those two things, are not good. We target specific numbers, for diabetics. And then the other things for prevention as well would be, we have to check the feet all the time. And the patients also have to remember, take off your shoes, check your feet every day.
Mm-hmm.
And then we check for numbness and, decreased sensations also. So that's why we tell them also wear proper footwear, especially if you're diabetic. You don't want to be wearing slippers, even if it's just, in the house, or especially when you're going outside. Other things would be also like your eye exams. So those have to be up to date every time. So at least every 1 to 2 years, depending on what your exam showed the last time. But those would be updated. And of course, there's blood work that we need to check regularly, including urine as well. Because we're trying to prevent complications of diabetes. So we're looking at them early on. Right. So that's why we have to do these things, routinely.
Yeah. So a lot of people kind of go to the doctor, they get the testing done, but maybe they just don't really understand, why did they just make me take my shoes off? Why are they always touching my feet? And why am I always having to leave a urine sample and so forth? They say my blood sugars are controlled. I'm not taking any medicines. Why do I still have to go through this? And as you mentioned, we're trying to prevent those diabetic complications. So circulation issues, nerve damage, eye damage, kidney damage, and then also making sure blood pressure, cholesterol, those things are well controlled, because along with diabetes, it increases the risk of heart disease and so forth. So we're always looking to try to make sure everything is as good as it can possibly be. Even if somebody comes in who's a very well-controlled, diet, lifestyle, they did all the things that we talked about, and now they're not on medications and their blood sugars are good, our job doesn't stop. We're still trying to make sure that, we don't encounter any of those complications. And the feet one, I think, is really important for San Antonio. We have a huge population of people here who have diabetes and develop things like foot ulcers and infections, and unfortunately a lot of amputations and so forth. So can you, I guess, go into a little bit more detail of if you're out there listening and you do have diabetes, what should you be thinking about as far as your feet and your circulation and things to check for every day?
Okay. So as I mentioned, like checking for sores, right? So checking for sores every day, because sometimes you may not feel it anymore. So when we say neuropathy, the nerves are damaged, and so they don't feel anymore, and it's a small cut. It can be a source of infection already, and you don't see them, and they become bigger until you notice them. So I think that's one. When it's very dry as well and you're flaking, that can be source of infection as well. So you want to moisturize your feet all the time. What else? Changes in color as well. So we want to observe those, and then bring it up to your doctor when you do notice them. And then pains, I think, is another thing, right? So especially, with circulation issues, you can have pain with walking, and same things, discoloration of your skin. So you want those checked as well.
Yeah, and the bottom line is just pay attention to your feet and protect your feet. I do get after some of my patients who are, they have diabetes, and maybe we know they have not the best circulation, and they come in wearing flip-flops, and no, we want to cover your toes, cover your feet at all times, because any small little cuts or anything can lead to an infection, and it could be a lot worse. And so inspecting your feet every day, making sure they're healthy, and really, if you notice any changes, bring it up to your doctor. We don't want to find out, 2 months ago I noticed this little spot, and I knew I was going to come see you next month, so I didn't mention it. No. We want to learn about that stuff as soon as it happens. So just be aware of your feet. Great. So what about any big changes, and I think there have been over the last 5 to 10 years, so forth, of medications. We see commercials and stuff for all kinds of new medications out there. What are some tips that you have for the diabetic patients and those listening about how to take your medicines? Should you take them every day or only when your sugars are high, etc.? What can you say about that?
So most of our meds, we do take them every day, including insulin if you are on insulin. I think, we need to understand, as doctors, we prescribe medications, and there's how long they last. So if they're every day, they're meant to be every day. If they're twice a day, they're meant to be twice a day. And I think also important with diabetics is also timing of their medications, right? So especially with insulin, but other medications as well, that we sometimes time them with meals, or you have to take it before you eat, or breakfast or dinner. So it's a little bit hard for diabetics. They end up with a lot of medications. But I think that's why we really have to help them, educate them the best that we can. And then that's why we emphasize it on each visit as well.
Yeah. So, I mean, medications, the big question I get asked a lot of times is, well, I saw a commercial last week for a brand new medication. I want to take that one, and I don't want to take my other ones. Well, a lot of the really good medicines that we have for diabetes have been around for a while. Yeah, there's still a lot of really new ones out there that we use a lot of times as well. But if what you have is working for you, then that's great. The one time where we, will consider medication changes and looking at your dosages, and where, like you said, timing is really important, is if, you do have diabetes and you're noticing your blood sugars are getting maybe way too low or really high, or maybe during the day you get a low one and a high one. So if you're having those kind of problems, bring it up to your doctor, because we want to know about it. And if you don't tell us, then, we're going to think things are going okay, and we won't know any better. But that'd be the time to change medications and maybe look at other therapies. We do have a lot of diabetic patients that we manage and take care of. And, sometimes I'll get approached and say, well, I don't see a diabetes doctor. Should I go see a diabetes doctor? And we have to kind of tell them, well, that's what we are as your primary care doctor. A lot of times we're able to kind of manage these things and take care of them, ourselves, and can do the right dosage. So what is your approach if somebody kind of comes to you and says, well, I need to go see a diabetes specialist?
Okay. So usually when the diabetes is controlled, we're really able to manage it as primary care. Or one or two medications, or even more than that, we really are able to manage it. Even on insulin treatment, as primary care, we're really well versed on those, as well. Yes. So even the new therapies that you mentioned, there are new therapies based on your, other risk factors or other medical conditions that we have to start you on. These are the newer, medications as well. We do refer to the diabetic doctor if your sugars we cannot control it. Like you're on already 5 different meds, you're on insulin, and we still cannot control it. Or your very high doses of insulin as well, and it still really cannot control. So something, else might be going on. Or if they're very complicated, or if there are complications, that on top of the diabetes, and that makes your diabetes a little bit more challenging. But most of the time, you're right, we're able to manage the diabetes the best we can.
Yeah, I think that for the vast majority of our patients with diabetes, we are able to kind of get things well controlled and look out for those complications like we talked about, and manage all the medications. I think there are very few times where, certain other medical conditions can cause the diabetes to be very up and down, and where we need maybe a little bit more help with adjusting medications and getting things under control. But for the vast majority of the times, I prefer to, sometimes if things are going very well, to maybe not get that other specialist involved. And it's nothing about their expertise, but really whenever we get another physician involved and we have 2 doctors trying to manage the same thing, that's where complications can come into play, and communication can be an issue sometimes, where someone changes the medicine. Well, I didn't know about that, and we change the medicine again, and now we run into an issue where we're having problems. So if we're able to manage it on our own, I think that's just the best way. As long as the patient's happy and the patient's healthy, that's the way to do it.
That's true. No, I completely agree. The more, you're right, we do need their help sometimes, but the more also people involved in the care team, it's sometimes hard for the patient, right? So it's hard to manage their meds. You said changing doses. One doctor sent this milligram and the other sent the other. So, that's where more problems come up. So, as much as we can manage it, we'll definitely manage it and refer when needed as well. Yeah.
All right. Well, Dr. Sepulveda, thank you so much again for talking with me about diabetes, and hopefully we provided a lot of good education for those that are listening out there. Again, can you tell us where you're working and how they can get a hold of you if they need a new primary care doctor?
Sure. So I'm at HealthTexas again, and I'm at the Wurzbach location. So And I just started there just over a month ago. So yes, please come see me at the Westpac location.
Yeah. And again, Dr. Sepulveda is accepting new patients. So if you do not have a primary care doctor and are looking for somewhere to go, and especially if you feel like you're having issues with your diabetes, well, here we go. We have Dr. Sepulveda to take care of you. All right.
Thank you.
Well, thank you again. And everybody have a good day. Thank you. Thank you for joining us for Wellness Wednesday. Again, I'm Dr. Stephen Ramos with HealthTexas Primary Care Doctors. If you have any questions or want to reach out to us, our phone number is 210-731-4800, or you can visit us on our website at healthtexas.org.